Representative from New York, Ms. Tenney is recognized.
Thank you, Chairman Smith and Ranking Member Neal, for holding this important meeting. And thank you, Mr. Secretary, for testifying before the committee. Over the past couple of years, many of us have shared numerous concerns about the Department of Health and Human Services prioritizing politics over its duty to promote and protect the health and welfare of the American people. This has included the HHS insistence to keep the unscientific CMS healthcare workforce COVID-19 vaccine mandate, referenced by my colleague from New York, Mr. Higgins, which has exacerbated healthcare staffing shortages, especially in rural districts like my own in upstate New York. The department has also spent time altering Medicare payments to re-incentivize doctors to develop anti-racism plans, for example, instead of boosting health care quality for all patients. At the same time, HHS has failed to properly implement bipartisan surprise medical billing provisions passed by Congress or reform its guidance to allow seniors to access new innovative treatment for Alzheimer's disease, as my colleagues have referenced. But I want to jump right into this issue about vaccine mandates, if I could, Mr. Secretary. Over the past few years, multiple scientific studies have found that the COVID-19 vaccines do not reduce transmission of the virus. In fact, our own CDC director, Dr. Rochelle Walensky, she's a doctor of medicine, unlike you and I, or doctor of laws, she said in referencing the COVID-19 vaccine, what they cannot do anymore is prevent transmission. So you just stated in your testimony today that the reason we're extending this vaccine mandate, especially on healthcare workers, until November of 2024 is because of the transmission of the disease. This is causing huge problems in upstate New York in terms of staffing, as I indicated. In the Finger Lakes region and Buffalo region, which I share with Mr. Higgins, hospitals have had a 375% increase in contract labor costs due partly because of the vaccine mandate, having to hire visiting nurses, which are much more costly. There have been protests and a lot of objections to this vaccine mandate, particularly among nurses and those who served, those heroes who served when we didn't have a vaccine, who now have been laid off and lost their jobs, and we think this is unsustainable. What are your plans under CMS, and I know you've indicated to my colleague, Ms. Miller from West Virginia, what are your plans in dealing with this vaccine mandate now that we know that this is not transmissible by Dr. Rochelle Walensky, our CDC director? Would you be willing to overturn this vaccine mandate earlier so that we can get people back to work in New York and really provide the health care we owe to our patients?
Congresswoman, thank you for the question. And as has always been the case, and you could ask this of Dr.
Can you just ask the question, would you be willing to do that? Because I want to also add, a New York judge actually just struck down the vaccine mandate in January. So is this something you're willing to do to override this based on the law and also based on science?
The actions are taken based on science and the evidence, and that will continue to be the case.
So Dr. Walensky is not accurate as a doctor in determining that these vaccines don't transmit the disease?
So I'm not sure about the quote that you attribute to her, but what I could tell you is that Dr. Walensky, like all of those who are working on COVID within the Department of Health and Human Services, base their actions on science and the evidence.
Would you be willing to waive Novak Djokovic's entry into the United States to play in the U.S. Open tennis?
So you give me more power than I have, authority than I have.
Do you oversee the CDC?
CDC does not make the decision about who can come in and cannot come in. Those are issues that relate.
They could issue the waiver.
I'm sorry?
The waiver could be issued.
A waiver for one individual?
For anyone that's coming in. I mean, we have illegal immigrants crossing our border every single day who don't actually take the vaccine.
We provide the vaccine to those unaccompanied migrant children who do come into the country, yes.
And what about American citizens who choose to play in these sports that don't take the vaccine? They're waived from coming in. Are they dangerous to the...
American citizens are able...
Is that science? I mean, I'm just saying, we allow American citizens unvaccinated to play in the U.S. Open. So is that scientific? Should we mandate that they are vaccinated in order to play in sporting events, for example?
The actions that our administration has taken with regard to American citizens is to protect them as best possible against COVID. The actions we take with regard to those trying to enter the country are somewhat similar, but there are some differences because these are folks who are asking for permission to come into the U.S.
Would you say the decisions are political at this point?
Yep.
The decisions are based on science and the evidence.
My time is expired. Thank you very much.